The Resurgence of Measles. What you need to know. Hold on to your hats. America's hard-fought victory against measles is unraveling before our eyes. With cases hitting a 33-year peak in just the first half of 2025, public health experts warn this isn't just another outbreak, it's a potential tipping point that could erase decades of progress. But here's where it gets controversial. This crisis isn't happening by accident. It's the direct result of declining vaccination rates and policy choices that gamble with our collective immunity. As of mid-July 2025, a staggering 1,309 measles cases have been confirmed nationwide, surpassing the previous modern record from 1992. Vaccinologist Dr. Walter Orenstein, who dedicated his career to eliminating the disease, admits this resurgence feels personal. Measles is the virus I love to hate. After working so hard to eradicate it, seeing it return is devastating. The timing couldn't be worse. Summer travel creates perfect conditions for this ultra-contagious virus to spread. A single infected person can transmit it to 18 unprotected individuals. Dr. Tina Tan from Northwestern University notes that dropping immunization rates have created dangerous vulnerability pockets nationwide. With lower vaccination coverage and more susceptible people, travel becomes a highway for measles transmission. Here's the critical context often overlooked. The US achieved measles elimination in 2000, meaning outbreaks were contained within a year. This status survived a major scare in 2019, when New York outbreaks nearly crossed the 12-month threshold. But COVID-19 dealt a double blow. It disrupted routine vaccinations while fueling vaccine skepticism. Pre-pandemic, 94% of people were vaccinated across 33 states. That figure has now dropped to 91%. Shockingly, over 75% of US counties saw vaccination rates decline. Maintaining elimination requires 95% vaccination coverage, the herd immunity threshold, that protects unvaccinated infants and immunocompromised individuals. University of Pennsylvania's Alison Bottenheim compares this immunity to a national treasure. Like our parks or infrastructure, we've invested decades building this protection. Now it's crumbling. And this is the part most people miss. Computer simulations show that at current 90% vaccination rates, measles could become endemic again within 20 years, spreading continuously rather than in sporadic outbreaks. Stanford researcher Dr. Nathan Lowe clarifies, further drops could accelerate this timeline dramatically. But here's the hopeful note. Even modest improvements in vaccination could prevent this scenario. Controversy alert. While 90% of this year's cases stem from domestic outbreaks, especially this excess cluster that sickened 700 plus and killed 2, policy decisions are amplifying the danger. New CDC advisory members have questioned established vaccine schedules and downplayed measles severity. More alarmingly, the US withdrew from HA and halted funding for Gavi, the Global Vaccine Alliance. Epidemiologist Dr. Amy Winter calls this a devastating blow. We've gone from planning measles eradication globally to just putting out fires. This global disconnect creates a dangerous paradox. By weakening international immunization efforts, we inadvertently put Americans at greater risk. As Orenstein explains, when other countries have outbreaks, travelers can bring measles back. Supporting global vaccination isn't charity, it's self-defense. So let's confront the uncomfortable question. When vaccine policies ignore both science and global responsibility, are we choosing to surrender our public health victories? What's your take? Is this an acceptable risk or a reckless gamble with our children's health? Measles outbreaks in daycares, health risks and parental challenges. Imagine a highly contagious disease spreading through a place filled with vulnerable, unvaccinated children. That's the chilling reality of measles outbreaks in daycares, and it's happening right now in the United States. But the impact goes far beyond the immediate health risks. While a child's health is the most pressing concern during a measles exposure, parents are faced with a daunting 3-week quarantine, leaving them scrambling to juggle work and childcare. Take Martha Marfin, a mother in Iowa, whose story went viral after a visitor to her 9-month-old son's daycare tested positive for measles. Despite the visitor being vaccinated, the ripple effects were immense. Public health notification delays meant her son, too young for the MMR vaccine, missed the crucial 72-hour window for an emergency shot. He received immunoglobulin treatment, but the financial burden and logistical nightmare of a 28-day quarantine left Martin and her husband reeling. Her TikTok plea, viewed 2.5 million times, highlights the harsh reality. Get your kids vaccinated. You're harming everybody else if you don't. And this is the part most people miss. Daycares operate on razor-thin margin. Measles outbreaks can be financially devastating, potentially leading to closures and leaving communities without childcare options. This echoes the struggles faced during the COVID-19 pandemic. Ruth Friedman, a senior fellow at the Century Foundation, warns if you destabilize childcare attendance, programs can quickly close their doors. But here's where it gets controversial. Should parents be held accountable if they send a potentially exposed child to daycare? A Philadelphia outbreak in 2024 stemmed from a parent doing just that, despite knowing the child had been exposed. This raises ethical questions about individual responsibility versus community health. The situation is further complicated by the lack of federal paid sick leave mandates. Parents are often forced to choose between their child's health and their livelihood. As Dr. Tina Tan, president of the Infectious Diseases Society of America, emphasizes, daycares are a terrible place for measles outbreaks. Babies too young for vaccination are at very high risk for severe cases. So, what's the solution? Increased vaccination rates are crucial. Iowa health officials now recommend accelerated MMR schedules, with the second dose as early as 28 days after the first. But it's not just about vaccines. Strict adherence to illness policies and excluding sick children from daycare are equally vital. What do you think? Should there be stricter penalties for parents who send potentially exposed children to daycare? Should paid sick leave be mandated to alleviate the burden on working families? The debate is complex. But one thing is clear. Protecting our children from measles requires a multifaceted approach, combining individual responsibility with systemic support. Measles cases surge 4.5 times higher than last year. Brace yourself. Measles is making a dramatic comeback in the United States, and the numbers are more alarming than most people realize. Imagine this. Cases this year have skyrocketed to levels the country hasn't seen in more than 3 decades. And the story is sparking intense debate. But here's where things get even more unsettling. The vast majority of these cases involve people who weren't vaccinated. Are we sliding backward on a disease we once had under control? Let's break down the facts. As of now, health authorities have confirmed 1,319 measles cases spanning 39 states, according to the latest updates from the Centers for Disease Control and Prevention CDC. To give you a sense of the scale, this is a staggering jump. Over 4.5 times the total number reported for all of last year, which saw just 285 cases. In fact, this is the largest measles outbreak since 1992. More disturbing still, measles has claimed life this year. 2 children and 1 adult have died, the first documented deaths in 10 years. According to the CDC, out of every 1,000 children who contract measles, 1 to 3 will die, usually due to severe complications affecting their breathing or nervous system. And this is the part most people miss. While measles is often thought of as a routine childhood illness, it can be devastating, especially for those who are vulnerable. A remarkable 92% of current cases involve people who have not been vaccinated or whose vaccination status can't be verified. This points to a controversial and growing public health dilemma. Are declining vaccination rates putting us all at greater risk? For some, the answer is clear, but not everyone sees eye to eye, and the debate over vaccination mandates versus personal choice is heating up. To understand how we got here, it helps to revisit recent history. Measles was officially declared eliminated from the US in the year 2000, an extraordinary achievement largely thanks to widespread, highly effective vaccination programs. Yet, there's been a worrying shift. Childhood vaccination rates have been slipping. Recent CDC data shows that the percentage of kindergarteners meeting state-required vaccinations fell from 95% in the 2019-2020 school year to under 93% in 2023-2024. That 95% mark isn't just a nice statistic. It's considered essential for maintaining herd immunity, the protective barrier that keeps outbreaks in check. That drop means roughly 280,000 kindergarteners nationwide, about 7.3%, are now left without protection against measles. Consider the implications. Communities with pockets of unvaccinated children become potential hotspots for outbreaks, putting those unable to be vaccinated, like some infants or people with certain medical conditions, at elevated risk. To appreciate the stakes, think back to life before the measles vaccine arrived in 1963. Nearly every child caught measles by adolescence, leading to approximately 500 deaths and 48,000 hospitalizations annually. The development of the measles vaccine changed everything, reducing these tragedies dramatically. Today, US children are advised to receive 2 doses of the measles, mumps, and rubella MMR vaccine. Once at 12 to 15 months, then again between ages 4 and 6, with 1 dose offering about 93% protection, and the full 2 doses raising that protection to 97%, the vaccine remains a cornerstone of public health. Notably, adults who've already been vaccinated or have recovered from measles typically don't need a booster. Here's something bound to divide opinions. Should stricter vaccination policies be enforced to reverse this trend, or should personal choice take precedence, even if it leads to increased outbreaks? Where do you stand on this issue? And do you think the resurgence of measles could convince more families to vaccinate? Or will it deepen the resistance? Let us know how you feel in the comments below. Your perspective might just help change the conversation.